Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and Jorge André.
Hi guys, so welcome to season 2 of the Soft Bites podcast. I'm thrilled to be here with my good friend Aalok Shukla. And I think I've mentioned your name a lot in the podcasts, and it's a really pleasure to be here with you because I've been telling many people that you've been very influential in my professional and personal life. So many of the things that I talk about, I learned with this guy. And he's always been very supportive in any way, even in the things that because we have different backgrounds in dentistry, but he's always been pushing me, and I think we'll have a good time interviewing him because he's a really special character, and I'm looking forward for this interview. So,
well, thank you for inviting me. It's a pleasure to join you, Jorge and Manuela. Really looking forward to talking with you guys.
And the funny thing is that we were even talking a few days ago. We were talking like when we first met, what we wanted to accomplish a few years back. That was like in 2005, I think.
Yes.
2005. So we were both thinking about the things that we wanted to accomplish, and sometimes we complain a lot about things, but actually we've both made exactly what we wanted to.
Yeah,
so I'm here in the Moreiras, in this amazing office, and Aalok is now, he has a company with more than 50 employees now.
Yeah.
He's quitted dentistry, he's quitted clinical dentistry.
Clinical dentistry.
Yes, exactly.
Yeah, still working it. But like,
Yeah.
And we're both talking that, so at the time I wanted to do mainly publications and mainly give courses. And it's very funny that we are both now in the point where we are redirecting the goals that we both have. But actually, we feel very lucky because in every aspect of our lives, we feel very, very, very fulfilling. It was really funny to understand that the conversation that we had a few years back, they actually, which seemed like a very far away dream, right? But actually, they step by step they become reality. So it's very interesting. So this guy has a very unusual path in dentistry. I think that if you were about to guess, you wouldn't guess it. So basically, you started studying medicine, right?
Yes.
So then you shifted to dentistry. Can you talk a little bit about that?
Sure. So my parents are from India. My dad's a doctor. When you're a little kid and all the relatives say, what are you going to be when you grow up? It's like, okay, I'll be a doctor. And, everyone says, oh, that's great. So my dad kind of guided me down that way. I was always good at science, good at maths. And I thought, yeah, medicine is interesting. But I think when I got into medical school, I was actually thinking then, I am actually in medical school now and I'm going to be a doctor. And I just thought to myself, like, at that time, a lot of hospital practice and maybe some politics in hospitals or different things. I just had a greater desire for being able to control my environment more, maybe work more independently. And I didn't see a pathway. Now it's different, right? But at that time, I didn't see a pathway to be more creative in medicine.
Mm-hmm.
Maybe it was my lack of imagination. So I thought dentistry is similar. It's like science, biology. But at the same time, you can have your own practice. You can then do things how you want.
Mm-hmm.
So in my first year, I switched into dentistry, and that's where it all started.
What did your father thought about
it? It was really bad actually, because he'd actually come to London to arrange a flat for me, and I was with him the whole day, and I didn't tell him. And then he was on the train on the way back, and I told him
your father is a psychiatrist.
He's
right?
a doctor, yeah, psychiatrist. And I told him when he arrived back at home, and he was. To be fair to them, they were like, "What?" And then they were so shocked. And
what
then
are they going to do?
They didn't know any dentists, basically. They had no reference. So the thing is, I think in life, if you don't have a reference for something, you then don't know what to expect. But anyway, they supported. And I think you don't always make the right decision, but you make the decision right. So for me, it was the right thing. And it worked out
You were like in the first grade of medicine, right?
Yeah, I was in the first year. So halfway through, like we did the first 2 modules was common with the medical students and the dental students. And then it switched over to do head and neck. And I think medicine was doing alimentary renal. And it was literally at that point I switched over. And then, obviously that's where you start, isn't it? So head and neck.
Yeah.
So, let me tell you just, Alok, how happy I am to be here and to finally meet you, because I've
Likewise.
heard André talked about you lots and lots of times, always good things. So it's a really pleasure to be here and to have you with us here. I want to ask you, how did you got interested in marketing, management, coaching, and all of those things? So after you finish your dentistry degree, how did you got interested in all of those different fields?
So I think it all started from having a vision that, like, of what kind of practice I would like to kind of work in, who I would like to be able to help. And I think I always felt I want to be able to, like, help people that want my help. And I also want to be able to do things which are as positive as possible, right? So I was more interested in cosmetic dentistry because, like, that was, like, quite attractive, but I didn't want to cut anything down. So I was interested in non-invasive stuff, right? And so very quickly I started to understand that I'm going to have to learn 2 things. I'm going to have to learn how to treat cases in a way which I feel happy delivering that result for a patient. And I feel that that's the right thing to do because I've not compromised anything. But at the same time, I've got to figure out how to attract those people to the clinic. And I'll be honest, when I was in dental school, I was living in London. So I used to spend all my time at the bookstores. I just loved reading, basically. Yeah. I was just reading a lot of books on marketing, management. I was just curious, basically, right? Like anything to do with, like, success, self-improvement. I was just very curious, right? And I found that more interesting than histology, I'll be honest with you. That's just me.
I think curiosity is a very important skill in dentists. I think sometimes it's missing to some dentists. I think it's something that should always be grown, and you should always have it in order to continue to grow in your profession.
But just as a person, we're always going to be growing, really, isn't it? Right? If we're doing the same things now that we were doing years ago, then there has to be some evolution, at least in your own, even at least in your own capacity of, like, what you can do. I don't know. That's just how I think. Like I think that, like, I compare against myself, and I think, like, are you progressing? Are you going where you want? Are you being in congruence with what you believe?
With what you feel,
exactly.
But I remember one of the first times that I've met Aalok. No, actually, it was the second time we first met in London. Then you came over to Portugal, and then I came over to you. We did that Tony Robbins thing, the Unleash Power Within.
Yes.
So it was very fun. And when I got to his place, I saw these huge amounts of books on psychology and coaching and personal development, which I was completely unaware of. I was a little bit biased, actually. And it was very funny to understand that this guy is really, really trying to make the best out of himself. So it was something completely new to me. Now, if you talk to any kid, it's something that it's normal, but that was in 2005. That was 20 years ago, almost.
Almost 20 years ago.
Even for a Portuguese guy, that was
But that was a great experience.
It was very good. It was amazing. It was amazing because even I was completely out of my comfort zone when you started to teach me about managing and trying to show me the importance of organization.
We were talking about E-Myth. We were talking about, like,
exactly.
We were walking. I still remember we were walking. I basically stayed with you for like a week, and I was basically hassling you the whole week, like, why aren't you doing this? Why aren't you doing that? And then I remember at one point we were walking past your house, to like a cafe, like in the park, and then you were like, you don't understand, you don't understand, you don't like when you're too busy doing this, and I was just listening, and I was just smiling, and I was like, but that's exactly why you need to have but it's true also, like at that point I didn't have my own practice at all, right? So at that point I was watching you doing everything, and I was like, my God, like I remember when you presented your work at the King's College. We were studying prosthodontics, right? And it was a residential for a week. And so there, Andre was presenting some of his cases. And I remember that whole evening, everyone was mesmerized because he had so many amazing cases. And I remember listening and seeing it. And I was like, my God, your cases are like just like any journal or magazine, and you haven't even done the course yet. And I was like, why are you even here? You know, like, and then everyone was just like stunned. And I was like, but I thought your practice must be something amazing, right?
So like this guy must work in this like amazing, like top-notch practice. And actually, when he got there, he saw that it was like
a nice, humble practice,
of course,
nice practice.
But a small practice, and it was managed like you would manage like a cafe or something like that. So I was completely unaware of management concepts, unaware of organization. I just wanted to photograph cases and publish them international. So I spent there a full week, and that was a really pivotal moment in my life because I realized that if I wanted to follow the goals that I wanted to, like do more courses, publishing international, I need to have a team that supported me. And for when you start to manage people, I mean, if you're only on yourself, it's one thing. But if you start to manage people, and if you start to manage patients, and if it's a private company, which is actually it's a private company, there's so many things that you have to deal with, and you can ignore it. And I think in the beginning, every dentist has this reaction, oh, but you can't understand it. I have a lot of work. This is not possible to do. So I was completely out of my comfort zone.
But it's your mindset, right? Like if you reflect what you see around you, and if you believe you can't, then obviously you can't. If you believe you can, then you need to see enough examples around you to then figure it out.
And hanging around with this guy, it was so completely different from any other people that I was used to deal with in Portugal, because dentists in Portugal, they go there, they have this path, they open a practice, and they do this. I mean, hanging out with this guy was a completely different energy from anything that I've ever thought of. And we also had a lot of fun in London. We would go out a lot. We would go to concerts. We would go to music. We spent a lot of time in bookstores at Waterstones. Right?
Yes, exactly. Yeah.
So it was a really pivotal moment in my life. So it was really, really nice. So you opened a practice, right?
Yes.
But then at some point you decide to quit clinical dentistry, right?
Yeah, that's a journey, right? So I think basically from when we met, like I was on my journey of improving my skills, like learning more about, how to do different procedures that I liked. I started working originally in national health practices because I didn't actually do very much work at university. So I wanted to gain more practice once I qualified and felt more confident and see more patients. And then I wanted to work in private practice. And so I was doing a lot of courses, improve my clinical skills and ability and all that stuff. And then I wanted to have my own practice. So in 2009, I set up my own practice from scratch, found a premises in London and opened it. And I remember you came down and you helped me with like some of the stuff when we were fitting it out. And I wanted it to be as nice as possible. Like, so we had like spa beds instead of like a dental chair. I didn't want anyone's scary chair. I wanted like, oh, that's a really comfortable bed. That looks nice. There's a TV in the ceiling. It's just like very focused on essentially aesthetics and prevention and that kind of thing. So I wanted to kind of have the vibe of like not just a dentist. Nothing wrong with that, right? But I just felt that I wanted to try and have a place where people wanted to come and would come specifically rather than, oh, this is the local place, let's just go here, basically, right? That was kind of my thought process. And so open that. And you learn what you don't know. And I think very quickly I figured out that like, in order to attract patients, because it's one thing to open a practice and spend a lot of money on opening it. And then you look at like, okay, I basically have enough money for the next month, but I have to figure out how to pay for the next month after that. And then the month after that. So then you very quickly have to figure out how to get patients. And so started doing some online marketing, local marketing, different things like this. And I just found it was interesting because I could start applying things that I'd read before. And, fast forward a few years and we had one package about teeth straightening, which we made a package where it was like basically some removable aligners, some whitening, some bonding, and I called that package Straight Smiler. And we'd create a flyer and some different things, and that was the most popular package by far, to be honest. Like, and what we had was like we put like an A board, like a sandwich board outside the clinic, and I remember like this was after about 5 months, and it had like the package of the Straight Smiler offer, it had the price and everything included, and it showed lower teeth from crooked to straight in 6 months. And I had people that week, I think I had 4 people walk in and say, I want that. And I remember thinking, you're such an idiot, Alok. Like, why have you been messing around with like online stuff, things that you didn't put a sign in front of your clinic, like explaining what you actually do, and people actually walk in from that, so sometimes you think, oh, complex is good, but it's not. Just do the basics first, right? But anyway, skipping forward a few years, teeth straightening had become essentially 50% of the practice. So the practice was called Alkali Dental Studios at that time. And so then I was thinking, really need to kind of like increase the amount of teeth straightening. So we created a second website called ilovestraightteeth.co.uk. And from that one, we really looked quite big. So we had like a free guide, online opt-in, online consultation, all that kind of stuff. This was back in 2013, basically, right? And so we were doing Facebook advertising. We got a lot of people. I remember the first time I created this straight teeth test. So I created this thing where people could answer different questions, find out what brace is suitable for them. And based on the questions they would answer, I would get all the data in a CRM email system. And then also based on what they answered, like, do you have a special occasion? Yes or no? They would get a different video. So I recorded different videos saying like, okay, oh, it looks like, time is important to you. So these braces are going to be better, either clear fixed or braces behind your teeth. But if you want to find out more, you can send some photos or you can come in for a consultation. And I remember the first day I put it live, we had like 30 or 40 people do an online consult.
But were any dentists doing something similar at that time?
No, not that I was aware of.
That's in London, a high competitive market.
Yeah, not that I'm aware of, like back then. And so what that then, I remember I was sat at home on my laptop in my bed and I was looking and suddenly I saw these straight teeth test, complete. And I was thinking, my God, like it's just like you opened a tap, right? Like so suddenly you've just connected this pipe into the universe, and all these people are saying, I want to improve my smile. And at that point, naively, I thought, wow, all these people want to come into the clinic. Obviously, they didn't all want to come in at that point, right? But it's like you're excited by the possibility of connecting. Yeah, and so what I saw was that people want something affordable, fixed price, guaranteed outcome, evening open, all that kind of stuff. And so that clinic, grew a lot. And so I managed to like reduce my days, but I still saw that there were so many people doing an online test than would ever come in for a consult. And they were all over the UK, even internationally, that were doing it. So then I thought, okay, how could we send some of these patients to other practices? So we started a marketing company where we basically replicated the same system, but we didn't call it I Love Straight Teeth for those places. We called it something else, Straight Teeth, whatever. And then we had the same system and they would get loads of consults in. And I would say, like, look, keep the price like affordable as the basic one and do volume, right? Like, because I've never been the guy like I'm going to charge like a 50 grand case. I'm not that guy basically. I like to help as many people as possible, and there's nothing wrong with that, right? Like some people have amazing skills and amazing abilities. I don't have those, so I'm more interested in helping more people, and I just think it's cool basically. I just find that cool. So from that, I always used to say like keep the price fixed, but then a lot of clinics I saw that we worked with would then say, oh, but this price is going to be higher because it's more complex. And I'd be like, no, you're not going to convert. The people are not going to go ahead because on the website it said one thing and then the experience in reality is not matching that basically, right? And, to cut it simply, I always recommended presenting two options, like a basic and advanced. But anyway, we saw there were lots of people doing online consultations. And this was like 2014. Across the UK. And then at the same time, I saw Babylon Health. So Babylon Health is like a large telemedical company. They do like online GP, that stuff that was starting. Also, I was reading a lot about exponential technologies, 3D printing, costs of everything kind of coming down. And I just started thinking to myself, like, look, there's so many people doing online consults. So the demand is there. But the issue is cost and the travel. Like they're just not able to do those two things. So is there a model we could use to evolve that way? And so that's when we decided, actually, look, there's going to be a model of using essentially telemedicine and 3D printing for aligners and have a teledentistry model of teeth straightening. And I thought, like, this is in 2014. I was like, this is going to happen for sure. And I was like, I need to be on this basically, right? So then I put the clinic for sale, sold the clinic, and then we launched our first teledentistry platform basically, right? Like in 2016. And like I say, like, it's just, I think for me, it's more about like following where I think something is going to go, and then you kind of bet on yourself, essentially, right? Like, and working with a team, obviously. My co-founder Lucy is amazing. And without her, it would all be impossible.
Yeah, Lucy, of course.
Yes,
but you blend it with your interests.
Yes,
which is helping a large amount of people and using digital technology and stuff
exactly. So the whole point is like, how can you? So we know that like 70% of people have some form of like crooked teeth, right? If you compare it with the ophthalmics, like the optics, for example, 70% of people need some form of vision correction, okay? 8% of people adults in the UK wear contact lenses, okay? I think, nearly 50% of people wear some glasses or something like this, right? So penetration and adoption is high. So glasses, let's call it fixed braces, right?
Okay.
Like that's like the bit that you might kind of go with. It's not quite the same, but here we are. Say contact lenses are discretionary purchase. It's like, I need vision correction, but I also need something which fits with my personal identity and the way I want to look. You've got laser eye surgery, which is a whole other ball game, but like essentially contact lens or laser eye surgery is like where people are in that way. And like, I felt aligners are like the same thing basically, right? Because they want to have the teeth straightened, but they don't want to wear glasses. So they don't want fixed braces, right? But at the same time, they don't want laser eye surgery because they might want that, but it's quite a big jump to go from nothing to laser eye surgery, right? But like contact lens in between provides that. So the same way with aligners, it's like you could see that, okay, over time, as costs go down, 3D printing, you minimize the number of visits to the clinic. So chair time, which is the most expensive thing to practice, is reduced. So therefore, the practice could actually have a higher hourly rate while reducing, like the cost to the patient
and helping a higher amount of patients.
Correct. I just think it's more sustainable to have a high volume, because if you've got a high volume of patients, if a few don't go ahead, it's not a big deal. But if you've got like 3 £25,000 cases and 2 of them cancel, what are you going to do? So it's a different model, right? It's a different model.
Yeah.
So that's where like the evolution kind of like started from there. And, we've continued that evolution. So we have another platform which provides online dental health assessments. And we've also extended the platform where clinics, dentists can offer a hybrid model of teeth straightening. But essentially what I'm focused on is I think everyone should have digital access to dental care. It's just very simple, right? Like you can visit a GP online. You can potentially see a dermatologist. I booked an appointment for my dad, for example. He needs a dermatology consult, and I sorted one out with him for a dermatologist. And so people want to be able to access care. So why is dentistry just locked in a box, basically, right? Like,
that's a good question.
So that's where I think like if people had access to screening, then they can engage with the practice. They can then get the advice, go into the practice, and it's like a continuous relationship as opposed to, solve my problem. All right, I'll see you in 2 years' time, basically. So
So you created the company from scratch. So tell us a little bit more about that. How was that? And any difficulties, any difficult moments that you want to mention? How was that?
I think like everything. I think like in the middle of starting it, like Brexit happened basically, right? Because we always had this vision that we would, sell internationally, help people. Because I think when we launched the app, we had consultations from Japan, USA, all over the place. And I remember like I think within a week of launching, there was like a guy from Japan said, "Can I pay now, please, for my 2 daughters? Because it's cheaper to do with you than it is for one of them here. And I don't want to choose which one gets treatment," basically, right? And I was like, and straight away I was like, you validated that like this is exactly the kind of thing that you want to help unlock. But obviously, it's one thing getting an online consult, it's another thing having the whole mechanism, support, infrastructure, dentists working for you, laboratory, all that kind of stuff, right? So you start step by step, right? I remember like there was a lot of challenging moments. And also when Brexit happened, we were like, we need to have some form of European base. And then that's when we actually thought, where should we kind of go? So we obviously sold the clinic in London. And I thought, you can't really stay in London because what's going to happen is London's going to change all its rules and regulations just for London, and it won't apply internationally. So I needed some kind of EU base at least, where we could then help people in different countries, across border healthcare, all that kind of stuff. So my co-founder Lucy, she's French. I didn't fancy going to France, essentially. Then I was thinking, where would be good? Like at that time, Portugal was becoming more and more popular because of Web Summit for technology. And I'd been to Portugal a few times already to visit Andre. And I just thought, everyone's really friendly, good English speaking. Let's go to Lisbon, basically, right? So we basically then decided after Brexit, we then organized that trip, packed our bags and just left, essentially, right? So that was that was quite a big thing. So that was quite a big thing. It was exciting as well, right? Like 2017, we landed here. And then, you're here, you're then building a team, you're recruiting people, and they're like, what are you trying to do? And you explain it, like, really? you're going to try and do that, like, and it's just like, but it's so what's so cool is that we've got dentists that have been with us for like 5 years. So some of the dentists that work with us are the most experienced in, teledentistry, digital consultation, because they've seen thousands and thousands and thousands of cases. Like, and some of them were quite young when they joined us, like, and maybe they were like, I don't know, 25, 26, and like, 5 years later, they've got like so much experience because they just seen like thousands of cases, like, and I think it's challenges along the way. I think the most important thing is having a very strong team and having a very strong, co-founder. And then really then every day is just like problem solving, right? So what's the problem I need to solve today, basically, right? Like, and then
so sometimes we think like in small practice, we have some issues. Look at this guy. He has more than 15 employees. Yes, I think that you are dreaming, you are like living the dream life. You came to the California of Portugal, you live in Caparica. So you have this
very lucky,
amazing office with this amazing view over Lisbon in Amoreiras. And sometimes we think like in a small practice, when we have to manage like 5 or 6 people, we think that we have some issues. And of course we have. But sometimes I can't even imagine the mailbox of this guy with like a team here, a team in UK.
But you know what? What's funny is like every stage you're at, whatever you face fully. Like it's never like I remember, like, for example, in my practice, like when I got my first associate, like that was a big deal for me because I was like really scared. Like, what if they mess it up? What if they say something to the patient which doesn't work? Or what if the patient gets upset? And I remember like we had a consult room. So what happened is we had like a staff room, but then they would have a consult room, and then there was a treatment room basically. And like at that point, I would sit in the consult room and I thought I'd try and do some emails and stuff, but all I could hear was the conversation of the associate. Like, and I remember at those times I'd be like, "Oh my God!" Like,
what is he saying?
So at those times, I think I'd be more stressed, maybe. Like,
now.
No, I mean it's different. At different stages, you go through different bits. Don't get me wrong, right? But what I'm trying to say is, it's never insignificant what you're having, and the challenge you have at that stage. You feel it fully, and you feel it in your body.
It occupies the full spectrum of your attention.
Exactly. So all it is that you just, as you move to different things, you have different problems with bigger consequences, right? So like, like that's all that happens essentially, right? Like,
so why would you focus on aligners?
So like I said, like I recognized we've been doing online consultation since back in 2013, essentially. And I saw that there's like, that's not going to change. Like there's going to be so many people that want to have their smile improved. And we were talking about figures like 70% of people have crooked teeth, but not even 25% of people get their teeth straightened, right? So I figured that like by increasing access, reducing costs, reducing frictions, there'll be enough people that want that. Plus also, I'll be honest, I found it really interesting, the fact of like optimizing manufacture. Like how can you use 3D printing, maybe robotics, different things like this to reduce the cost of manufacture, increase the predictability. I was always interested in like manufacturing as well. Like I have weird interests. Like you had the ability to control the full stack, and so I thought it's a cool thing. You help people have something they couldn't access before, helps change their life in a small way, and we get really amazing feedback from people like saying like, I always want to straighten my teeth, but I could never afford it, or I'm busy looking after my son who's disabled and I can't travel often. And it's just really reassuring. And now, for example, working with practices, what's really cool is like working with practices that maybe have got a bit stuck and a bit stagnant, and then we help them by essentially bolting on like, digital consultation modules, digital communication modules, so then they can help grow their practice more. It's just, I think, the impact that technology can have, it's just interesting. So yeah.
But both your company, like Uplift, you work it is telemedicine, teledentistry, but you work very closely with dentists, right?
Of course, because the whole thing is it's a dentist.
I mean, it's not about not needing the dentist.
No. So the thing is, what we have to look at is patients need diagnosis, they need care, they need emotional reassurance, all these different things, right? But you can do that in person, or you can do that by a WhatsApp message, or you can do that by a phone call. Everyone's got patients that like leave a message at reception saying, I'm a bit worried about this. Like I remember I had a patient that was like saying, oh, I'm a bit concerned. and my tooth is a bit wobbly when I was in practice. And I was like, okay, look, if you're worried about it, I'm worried about it. So call me, basically. At that point, we didn't have video phones and stuff like that. But at that point, could have said, send me a video, and they could see what it is. So all it is just enabling digital communication with dentists, right? So it's just opening a new channel. So it's not just like what you see with your hands in front of you in your chair. It's also who you can support, reassure, screen, look after digitally. So that's all it is, essentially.
Yeah, but I think dentistry, from that point of view, I think medicine has found that many years ago. Yeah. But dentistry, I don't know why, we are still we think that we are only doing dentistry when we are with a patient in the chair.
But that's because dentistry has come from surgery, and the dental clinic is basically an operatory. Basically, it's like a surgical treatment room. However, in dentistry they talk about prevention, but you can only prevent something if you screen it. But when can you screen it? If you're only screening when they come in for a checkup and pay for a checkup, by that point it's generally late, because most people are not going to come in regularly for that. So you need to have a system before the surgery.
One of the things that I found really interesting, I don't know if you have the camera that you use, you have it there?
Yeah.
Here. So one of the things that I found really interesting, one of the ideas of this guy is, so when did you, of course you're talking about prevention, when did it came to your mind to integrate this, to have this sort of follow-up of the patient in the practice? How did that come into your mind?
Well, mobile phones enable communication with everyone, right? But we all know that the photos from a mobile phone are good for macro, okay? You can tell, arch position, you can tell tooth position, you can tell different elements, but not great for micro. You can't see a wisdom tooth at the back of the mouth, you can't see platal surfaces, things like this, right? So if we think about the future, right? So if we think 5 years from now, 10 years from now, whatever like this, it's obvious that there's going to be some form of digital screening for health at home, right?
Like it is an Apple Watch or something.
Exactly, but in different ways, right? So it might be that there are, let's just say, for example, your mirror. It might have a camera and it's checking your pulse rate. It's also checking your skin hydration level. Maybe it's checking for different things. This is going to come, right? So essentially, screening is going to become integrated into appliances. Maybe the toilet even has different things where it could test to see for different stuff, things like this. So basically, I always thought there's going to be a need for having a kind of we call it a dental scope. It's basically a wireless intraoral camera. If patients had that, then if there was one per family, basically in the bathroom, right, then anyone could, let's say, every 90 days just do a little video pan of the mouth. The dentist can review it, see if there's anything that's going on, and then recommend them to kind of come in. So I think that in the future, each family would have something like that in the bathroom, which would enable kind of regular screening. So, I mean, the whole point is if you think something, try and make it happen. And so the challenge then is okay, what's the model for that? How do you encourage that? How do you go down that way?
And then you think that this is something that that dentists should use, and you help them. So basically, you help them integrate this product into their own.
Yes. So what we've done is we've seen that the patients that are the most interested essentially in this kind of hybrid model of practice. So what I think is we're focused on digital access dental care for everyone. So I think that all dentists should practice physically and do some digital screening as well, right? I think all dentists should basically, right? Because then you're going to be able to help more people, see more patients. I mean, I'm sure everyone's got family or friends that have asked a dental opinion.
Yeah.
But they're not near your practice, basically. And so what's the difference, right? It could
just send me a photo on WhatsApp.
Yeah, versus if they actually had, let's say, for example, a camera, let's say they're on a digital prevention plan, they subscribed, then they could actually get proper advice and prevention. And I think separating out diagnosis and prevention from operative treatment also makes things more transparent, because if the person who's diagnosing you and screening you cannot actually operate on you and has no financial incentive of being able to do a filling or a crown or whatever like that, what they're saying is true, basically, isn't it? Right. So anyway, that's just by the by. But I think having what we do is we've got the aligner packages for dentists for our package Virtuoso, and we include a dental scope for each patient within that. So the whole point is that each of those patients that go into the practice start on this whole digital monitoring model where they come into the practice for their aligner pickups, 3 batches, but then in between they're doing monthly monitoring. So by integrating this with people that are already looking for something, which needs 8 to 9 months, my goal is to help encourage more people to kind of go down that pathway.
And I think it's in the patient's best interest that whenever they feel something, they just record a video, send it to their dentist,
and it's stored on a platform where you can also compare against previous ones, right? So the whole point is like, oh, I've been coming to you every 6 months for like 4 years. Has this tooth got worse? Oh, I'm watching it. I read my notes. My note says I'm watching that tooth. But do I really know what that tooth looked like? Unless I'm taking photos each time. And let's be honest, not everyone does take photos every time, right? But the thing is, if you integrate the patient into your care, they can do some of the photos, they can record some of the stuff, right? And
so it's a much more customized treatment, because some people needed to go to the practice like every 3 months, some people just need to go like once a year.
It's based on risk factors, right? So you either got like biological risk factors of decay, gum disease, or you got functional risk factors of teeth grinding, cracks, and restoration stuff, or you got cosmetic risk factors based on like teeth arch narrowing, tooth wear, whatever like this. So if you help people understand what their risk factors are, so we're building a tool that will make it super easy for dentists to be able to like do a quick digital risk screen on a patient, communicate with them about what's kind of going on, then I think that the easier it is to communicate, and the more someone sees what's going on, the more likely they're just going to want to do something.
The more data that you get on a regular basis.
Yeah, and the more people will want to actually do something, right? Like I think the more data you've got, it's a positive thing. I mean, I myself use different digital health devices. Like I've got a glucose monitor, for example, like attached to my arm, so I can check like after I eat a meal, like was that a good one, not a good one, like was my blood sugar spiking, and drives more awareness and like.
But it's interesting, like dentistry did not dive into that.
It's always been subjective. It's never been objective, right? Like, and I think like nowadays by going through looking at digital images and then understanding, okay, I mean, you've always been very logical, and like you made these like flow diagrams of like diagnosis, like is the restoration greater than a third of this, then do this, then do that. Like we know all these things, right, from good treatment planning or foundational principles. But the thing is, like, if you integrate digital photography and digital risk screening and things like this, you can be much more objective, isn't it? Like, okay, in the last 3 months, we can see that there's been a great change in the amount of demineralization in that tooth, right? Versus if that tooth had stayed the same for like 4 years, it's a different risk profile, isn't it? Right? So it's all about context. And I think by using digital technology, you can gain the context of the past and also understand where it's trending positively or negatively, basically.
Okay.
Amazing.
The brain of this guy is like works to 200%.
I wanted to ask you, so you quitted clinical dentistry, you created a company from scratch, you are going in new pathways in dentistry. Do you think that we as dentists limit ourselves, so that because sometimes I think dentists have this tunnel vision of dentistry, also because maybe what society expects from us or what we think we should be or we should do. Do you think that we limit ourselves as dentists?
I understand. Like, I think when you go into a profession, you might think that that's the only thing you can do because you've been trained in everything in that area. But actually, to be a good dentist, you have to have a lot of skills. You have to be able to communicate sensitively and also have good leadership. So you can kind of guide your team around you to create the atmosphere for the patient. You have to have good organization skills to understand, okay, if I'm doing a complex rehabilitation for someone, there's many different steps I need to do. I need to have teamwork, work with the laboratory, work with my assistant, work with the receptionist. So the thing is, I think as dentists, they might not know that those are skills, and they might not think that they could use those in a different way. And I think that, like, if you think, okay, I have a dental degree, I practice dentistry, but maybe you don't say I am a dentist. I mean, you are a dentist. I'm being nuanced here, but the thing is, like, you can be something, but you can also be many things, right? Like you don't. It's just one identity doesn't envelop all you are. So I think, like, if you just reflect on what you can do, then and you think about what are the possibilities. I mean, these days there's so much you can do. You can be, educator on course. You can be, you can be like doing online things. You can do like, teaching. You can also just go into completely different areas. You can like study other subjects, like, you can study law, you can study like, like psychology, public health. You can go into so many different things.
Look at Manuela.
Exactly. So there's just so many things you can do while retaining your dentistry thing, or you can just not do that and you can do something completely different. Like I know a guy that like, moved from that into tech basically and just works in other areas like product management or different things like this. Like the question is like being authentic to yourself and what you want to do, and try and kind of like get yourself onto a pathway where you can kind of get to where you want to kind of get to. So you don't need to restrict yourself. Everything is open to you. You just need to kind of, think step by step. How can you kind of get what you want, basically?
Yeah. So, and if you look at dentistry today, and of course you have a lot of experience because you've been working. You've been helping dentists for many years in very different ways, right?
Yeah.
And I'm sure you see a shift over the last, I would say, I mean, things are not the same as they were 10 years ago.
No. Well, the pandemic happened, right?
Yeah, the pandemic happened. But I think that the mentality of dentists, it's only, and we see this a lot in the podcast with Manuela, we see that, especially after the pandemic, I think that dentists woke up to something, which is what we just talked in the last question, which is there needs to be something different in dentistry. There's something more about this. Maybe I need to be working less. Maybe I can eventually the online thing, maybe something. I have to deal with social media. I have to be a good marketer.
Yeah.
I have to be. So what do you think? And even before we start, I was watching you coaching a dentist, helping him to implement some marketing in his practice. What do you think that dentists struggle the most? I mean, they woke up to a different reality of all of a sudden, right?
The world has changed basically, right? Like, I know they're patients, but essentially consumer expectations have shifted from Amazon. You can order anything and get it the next day, or there's places where you can even get things the same day in 15 minutes, and that's just crazy. But like, but the point is, our kind of impulse of like needing things now has kind of been enabled by technology. So we want to see notifications now. We want to, people to respond to us now. That we've become very impatient. Now, what that means is that like and also we shop around a lot. So that going on to dentistry means that more people compare practices. They'll price shop more, because just like they buy anything, right?
Yeah.
Like nobody buys anything without looking around at different options. And so it's the same thing, because dentistry is elective healthcare. It's considered that way, basically, right? So people have discretionary amount of money. Will I spend it on holiday? Will I get my teeth done? Whatever, right? Different people have different things of doing it. So, but now you're absolutely right. It's a different world. Being a good dentist, technically, if you're working in a very well-run practice, then it's enough. Like in your practice, for example,
I understand.
It's enough to just be a very technical dentist in your practice, because you've already got all the systems, all the like marketing. It's more referral, but it's the same thing, right? So in your practice, you could just master your technical skills, and that's enough. And there are many practices that are like very leading practices that you can do that in. But otherwise, as a dentist, I think nowadays to kind of carve out your own space, you have to be good at communication. You have to be able to engage with patients and attract patients, right? Even if you're an associate, right? Like I think that's because basically practice owners will be getting interviews from people, and one person might say, "Oh, I have 5,000 followers on my Instagram, right?"
Yes.
And the other, and I can bring some patients in, and the other one hasn't got any. Then there's the practice owner. You're going to think, well, what's the difference in these ones, isn't it? And I'm not giving that as a direct example, but like when I qualified, this was not the case, basically, right?
But
like,
even I was talking, for example, Teresa that works with me. She had like an Instagram account with 0 publications, and there was no photo. I said, look, you are doing so many prosto in my practice. Well, just at least place a photo so that people can see when I tag you when the work that you do, So it's
no. So I think based on that, the dentists need to kind of evolve. But to answer your question, you can actually carve out a much more diverse career than you could before. You could say, okay, I want to do 3 days of hardcore practice, for example, and I'm going to like optimize my chair time and do quadrant work, and I'm going to only do the cases that bring me happiness and fulfillment with what I want to do. And the other days I'm going to do other stuff. Maybe I'm going to do teaching. Maybe I'm going to study. Maybe I'm going to work on something completely different.
Travel.
Maybe I'm going to create an online course, like whatever, right? You don't literally have a limit on these things that, or maybe I'm going to mentor or shadow someplace.
Yeah, but one of the things that whenever I heard about digital dentistry, I was like, well, but this is pulling away dentistry from medicine. This is making dentistry closer to marketing. But once that I realized, and I started to talk with Alok, which is actually the opposite, because the online and the digital platforms, if well used, they can actually bring dentistry closer to medicine, especially from a preventive point of view and from a transparent point of view. You remember that we were talking about the
Cascada, Cascada Declaration, right? Like I think there was all these esteemed professors basically said that like in the last 100 years or something like that, dentistry has not made any. It's basically more about delivering procedures and selling procedures than it is actually providing or preventing oral health. And it's the thing is the business model of dentistry is doing procedures, and of course people do need procedures, but sometimes people don't need procedures, and that's where it gets messy, right? Like because I've seen practices where people did stuff they shouldn't be doing, right? But anyway, that's a different story. But the point is that like that transparency of screening, that's why I think it's a good thing, right?
Yeah, but we as dentists, we always like to bring the medical part. Okay, we want to do prevention, but how can we do prevention? And I think the only tool available now to actually implement prevention is digital dentistry.
Yes, digital screening and essentially screening people at home, so involving the patient as part of the actual preventive program,
and also in remote areas.
Yeah, it has to be remotely, like because you're not going to be okay. You do a checkup, but that's not really screening. It kind of is, but everyone does not come twice a year or regularly on an annual basis. Like
So if you think about countries like in Africa or India that they are developing, there's a lot of sugar in their diet. What's the cost of sending a group of dentists to go there and do prevention programs? It's almost impossible to do that.
Yeah, I mean, look at UK, for example. In the UK, there's a massive crisis because the number of NHS dentists has drastically reduced. And what happens is there's many people that basically can't access an NHS dentist, and then they're not aware of maybe affordable private ones near them. There's no affordable screening possible. So one thing we've done, for example, we've introduced our interdentist model into pharmacies. So people can get like in some pharmacies, they could actually access screening at least there, and then being connected to a practice that could kind of at least connect with them and do something if needed. But yeah, I think you need to have more access points where you can have screening. I mean, the way I think about it is that like every employee in the future will have access to a digital doctor and a digital dentist and digital mental health, digital physio, basically, right? Like as a basic care stack. And so, yeah, I think
that's very interesting.
Then screening can actually happen, isn't it? Right. So,
yeah.
Mm-hmm. Yeah, my next question had to do exactly what you were just talking about you believing that digital dentistry is the future, and how do you see digital dentistry integration into regular dentistry? I think that you can continue.
It's just dentistry, right? It's just like I don't know, like how can I put it? Like I'm interacting with people physically, or I call someone on my mobile phone, or I text someone. It's still just me communicating with people, isn't it? Right? Like it's not online or phone and in person. Like it's the same thing, right? Like so. Yeah. I think the thing is, what there has to be is a more mainstream adoption of these modalities, basically, because most people aren't even aware it's possible, right? Like, and then the thing is, patients are more ready than the dentist, so more patients will do screening.
That's interesting.
Yeah. Like honestly, like what's crazy is like I see that like through our platform, like I saw a kid had done a consultation from school, and he had a really nasty lesion on his upper incisor, and I could see he's class 2, and he's got traumatic overbite, right? But it got so nasty that it was almost like yellow with pus and stuff like this. And like, so what I'm trying to say is that is people walking around with like stuff, and like there's a poor kid who's like kind of suffering in a school and can't get access to something, and at least if you do an online consult, get access to things, get the right advice, can share that with their teacher, and like if there's a boarding school, take them to somewhere. But I think basically patients are ready for this, right? Like, and the dentists that do implement it, our goal is to like help them, be more successful, see more patients, and build a more fulfilling practice where they can maybe work less days physically, do some work digitally.
Yeah.
I mean, like, there's too many things to do in life, right? Like,
and life is short.
for sure. That's it.
So, so you also have some you also have some charity work in India, right?
Yeah. So we do. So one thing that we do is we try and integrate. Essentially, you want to be positive, right? You want to help people deliver results in an affordable way, but at the same time, also while doing that, if you can do other things, it's nice. So what we have is we have nominated charities. So basically, when somebody refers a friend, we actually will do or writes a review. We will do a charity donation on their behalf, and they can choose which one. We generally have like different charities shortlisted. As an example, some of them are in India, some of them are in the UK. Like, for example, there's one Buddy Bag Foundation where basically kids that were in traumatic households, sometimes, like, let's say the one parent is abusive, they have to flee in the middle of the night, and they suddenly go to like a kind of like a place. But then when they go there, they don't have anything of their own. So this Buddy Bag charity, they create a bag for the kid, like it's called a Buddy Bag, and it has like stuff for themselves, like this is my stuff. And it's one of the things included there is a toothbrush, for example, some toothpaste. So
cool.
So we donate that as part of that. Plus we also make donations to the charity. But then there's also like Wells on Wheels, an amazing charity in India where they deliver these essentially like water wheelbarrows, right? So then it stops them people having to spend hours and hours getting water. But there's also like Paint Our World, which is a charity which deals with children that have been essentially traumatized and are kind of homeless, and helps them using painting as therapy to kind of like help them. So So these are just things like, I just think if you can integrate it into what you do, then it's a nice thing, isn't it? Right.
So as a final question, so let's imagine there are a few kids out there, 20s, they just graduated from dentistry. They look at social media, they look at their professors in the university, they look at the practices of their professors, and they say, well, I don't know if I want to be a dentist closed from 9 to 6 in an office for the rest of my life. I don't know exactly what I want to do. So what advice would you do to someone that wants to do something complementary of dentistry, or wants to see dentistry in a more he wants to have more freedom in dentistry? What advice would you give to someone that just got out of college and looks at dentistry as it is right now and doesn't want to fit in?
Okay, so I think the first thing is try and imagine what you would want. Like, what would your ideal day look like, your ideal week? Kind of get a feel for like what that would look like. So essentially that ideal environment and that ideal, like, what you would do, and be realistic. Like, it could be like, oh, I want to, when I say realistic, I mean like it should be something like, I shouldn't be like, oh, I get everything and I don't do anything. That doesn't make sense, right? Like, but if it's more like in terms of, okay, I want to be doing this type of practice, I want to live in a place by the sea, or this, then you start thinking, okay, that's what I want. Then start thinking to yourself, okay, who would I need to be able to do that, basically, right? Like, so the first thing to do is like focus on who can you be, and in order to be better, we can all be better in things like our, consistency, dedication, confidence. Well, confidence comes later, but like, how hard we work, how much we read. I would research online a lot. Communication, yes, I'd research online a lot and try and see examples of like people that are doing what you want to do, and then try and read about their stories, about how they got there. Then I would read a lot of books like 7 Habits of Highly Effective People. That's like the foundation, for example, of like, how to work on yourself for internal victory, then how to communicate and work with the world. And these things are things that you do on an ongoing basis, but essentially you want to expand your own capabilities so that you could be more valuable to a practice. So let's just say there was a practice opening by the seaside or whatever like this, and you could then apply and you say, look, I would like to join you. I would like to create a sleep apnea practice within your thing. I'm really passionate about this. I've been blogging about sleep apnea for a long time. I have lots of people that are on my email list about it. I give advice. I even have some products which support it, or things like this, which people buy. What I'm trying to say is like, you can totally basically manifest is the wrong word, but you can make happen whatever you want as long as you put enough focused attention and effort towards it. But you need to put a lot of effort towards it because the world is quite competitive. But if you keep doing it and you keep, you think what area you want to be in, and it's like, let's say sleep apnea or orthodontics or sedation, whatever it is, right? You then just own that and then just read as much about it, write as much about it, create as much content about it. Like that's a good start, essentially, right?
Again, even Manuela, who would think about bringing mindfulness to dentistry?
Exactly.
When we were talking about that yesterday, that was
I feel
you have created the field. You actually have created the field.
And I feel like I'm serving my profession better now.
Yeah.
Exactly.
I feel I'm serving dentistry better now than if I was doing clinical work. And I'm motivated to do all those. Many things that I do nowadays, that I do with such motivation and joy and pleasure that I didn't had when I just did the clinical work. So that was very interesting. I think that
you could impact more patients by impacting more dentists who have happier, more satisfied practice. So your impact is greater, isn't it? Right. So it's the same. It's the same. It's the same. So that's fantastic.
Yeah. So Aalok, thank you very much for this conversation.
Thank you so much.
I'm sure that in the future we will find some other topics to talk about, because I think this thing in digital dentistry is really, I mean, it's obvious. Sometimes you need some, because when you're a dentist, you are only focused on this, and sometimes you need someone outside to look. Everybody's going this way. Dentistry, medicine has gone there. Dermatology has gone there. Everything is going this way.
It's just opening a new door. Yeah. It's basically just having a digital front door, right? And the practices that adopt this, then more people can come in through that digital front door. It's way back when I told you, like in 2013, when I was on my bed with my laptop and I saw these like straight T tests. I just opened a digital front door at that point, basically, right? And I followed that door and came down this path, basically.
And
right?
The interesting thing is that you can eventually have more time to think about the things, or to do the things that really make you happy, and to move from to go from there, which is really, really interesting. So Aalok, thank you so much for having me.
Thank you so
here.
much for inviting me on.
And
thank you.
It's wonderful that you have chosen Portugal to live, because you are close to me.
Yeah, we can hang out more. It's good.
Yes, of course. So thank you so much, Manuela.
Thank you.
Hope to see you.
Thank you, guys.
In person soon. So take care.
And thank you for everyone listening. Bye-bye.
Thank you.